Is physician burnout causing you to lose revenue in your practice? Well, here are 5 secrets you can do today to reverse this trend. Studies have shown that physician burnout can lead to lost revenue for the independent practice. Burnout usually results from excess work-related stressors like excessive patient visits and the constant administrative tasks most physicians have to now complete. Risk factors associated with it can be divided into categories: work factors, personal characteristics, and organizational factors. For the purposes of this video, we will focus on the 2 that can directly impact you today.
My name is Theo Harvey. I'm a serial entrepreneur that went from a lowly employee to CEO of a multi-million-dollar healthcare organization that run from my home. I raised over $1 million from venture capitalists and other investors, and worked with large organizations like Cisco Systems, AT&T, Charles Barkley Organization, Blue Cross Blue Shield, and Google. My mission is to help healthcare professionals prepare for the new normal before it's too late.
Work-related factors can be high workloads, extended working hours, specific specialties requiring frequent call duties of patients. Next, we'll get into the organizational dynamics that can affect. The following 5 secrets can address the problem of lost revenue due to physician burnout and 5 ways to mitigate its impact, especially in the organizational and work-related factors. We will show how organizational factors such as unrealistic workload expectations and unlimited revenue opportunity can be addressed and improved through partnership efforts and targeted solutions. In addition, we can also demonstrate the systemic work-related changes that address the root cause of physician burnout. These secrets will reduce administrative burden, increase practice revenue, and provide better patient care. Let's get into it. Secret 1, keep patient satisfaction high with remote care options. This secret work-related change can reduce the doctor's work level and hours worked. For example, prior to COVID, many medical practices were staffed by a team of dedicated healthcare providers who had built strong relationships with their patients over the years. However, with the onset of COVID-19, these practices were forced to adopt remote communication methods, continue serving their patients while minimizing in-person contact. At first, the transition to remote communication was difficult for both the healthcare provider and their patients. Some patients were intimidated by the technology, while others struggled to express their symptoms and concerns effectively over the phone or via video. But the medical practices who stuck out remote care saw the reputations with their patients increase during the pandemic. For example, a survey conducted by the American Medical Association in 2020 found that 70% of patients who used telehealth services during the pandemic were satisfied with the experience. Another survey conducted by the Commonwealth Fund in 2020 found that 89% of patients who used telehealth during the pandemic said they would use it again in the future. Ultimately, patients reported feeling more comfortable and connected with the healthcare providers even when communicating remotely. This also improved many medical practices' financial stability. Not only were they able to take advantage of new telehealth codes that were there for new revenue, but patients were more likely to follow through recommended treatments and procedures the doctor recommended. This ultimately led to less stress on the practicing physicians. Secret number 2, record all training for your staff. This secret organizational change can increase interpersonal collaboration and increase employee retention. A report by Docebo, a learning management system provider, found that organizations that use video in their training programs see an average increase of retention rates by 25 to 60%. Training videos were important because they provide a visual and interactive way to learn new information or skills. Video training can help individuals understand complex concepts more easily and retain information better than just reading or listening to a lecture. These videos can also be a valuable resource for employees who need to learn new skills or procedures in a timely and efficient manner. They can be accessed at any time from any location, which makes them convenient for busy schedules or even remote work. Moreover, training videos can provide a consistent and standardized approach to learning, ensuring that all employees receive the same information and have the same understanding of procedures. Having a standardized operating procedures can help reduce errors and improve overall performance and quality for the organization. In addition, training videos can also be a cost-effective solution for organizations as they eliminate the need for in-person training sessions and can be used over and over again. Ultimately, training videos help physician owners retain key healthcare talent, and decrease operational redundancies. Secret number 3, leverage new value-based programs to grow revenue. This next secret will allow you to take advantage of new trends that decrease your workload while increasing your practice revenue and improving patient care. Value-based care programs are healthcare delivery modules that focus on providing high-quality care to patients while also controlling costs. In these programs, healthcare providers are incentivized to deliver care that is not only effective, but also efficient and cost-effective. The main goal of value-based care programs are to improve the health outcomes of patients while reducing the overall cost of healthcare. This is achieved by shifting the focus from the volume of care delivered, also known as fee-for-service, to the quality and value of that care. For example, the Center for Medicare and Medicaid Services has committed to moving every Medicare and Medicaid patient to a value-based arrangement by 2030. This fee-for-service model will continue to see reductions in reimbursements, while value-based care models will see further increases. For example, some of the new value-based programs are recurring monthly revenue for practices who take advantage of it now. These programs include CCM, Chronic Care Management, PCM, Principal Care Management, RPM, Remote Patient Management, and RTM, Remote Therapeutic Management. Secret 4, make sure you are billing correctly. This work-related change can reduce the doctor's work level and hours worked. For example, accurate medical billing is critical for any healthcare organization to ensure they're properly reimbursed for the services they provide. Inaccurate medical billing can lead to significant losses in revenue for healthcare organizations, as well as increased administrative costs and decreased patient satisfaction. The exact amount of revenue lost due to inaccurate medical billing can vary greatly depending on the size and type of healthcare organization, as well as the specific billing errors that may occur. However, some studies and surveys have reported the following findings. A report by the Medical Group Management Association found that on average, healthcare organizations lose 2 to 5% of their revenue each year due to billing errors. A study by the Healthcare Financial Management Association found that the cost of denied claims can range from $25 to $125 per claim, depending on the complexity of the claim and the reason for denial. A survey by the American Medical Association found that nearly 70% of physician practices have experienced revenue loss due to billing errors, with an average loss of $125,000 per year. With proper analysis, make sure you're getting your complete payment from your work efforts. If you believe you're not, my company SensorMed has helped hundreds of practices with their billing. We have helped practices recover thousands of dollars in revenue. Schedule time with us at the link below and let's see how we can help. Secret 5, work with vendors who want to truly partner and not just sell you a solution. This final secret organizational change can increase work satisfaction while also reducing workload. To succeed, it's critical to collaborate with vendors who are generally invested in your victory. Let's give an example. Say you're working with a financial planner on your retirement plan, and they recommend an aggressive stock portfolio promising a 10% year-over-year return. You have reservations about the sustainability of such a portfolio for your needs, so you ask your financial planner one question: would you be willing to be paid only if I achieve those returns? Unfortunately, most financial planners would decline such a proposition, and this highlights the agency problem. When financial planners are supposed to act in someone else's best interest, there's always a risk that they may prioritize their own interests over their clients. Without any skin in the game, they have little incentive to ensure your success since they've already received their compensation. Therefore, be wary of vendors who are not aligned to the goals of your practice, charge a minimal amount with no promise of ongoing support, and don't guarantee their results. These partners are not acting in your best interest. Choose vendors who want to win with you and make achieving your goals more likely. Hopefully, these 5 secrets will allow you to see the path forward to truly practice medicine the way you want to practice it.